If you have diabetes or pre-diabetes and your doctor is only checking your fasting blood sugar, you may be missing the full picture because there are 6 blood tests that can reveal what is really happening in your body and what you need to fix before complications begin. Hello and welcome. We are Famedix Help with Diabetes Care Center. Our mission is simple: to help people live healthy with diabetes, avoid diabetes complications, and reverse insulin resistance, which is one of the causes of type 2 diabetes. Let's begin. Many people think diabetes is only about blood sugar, but the truth is diabetes affects much more than that. It affects your heart, your kidneys, your hormones, your inflammation levels, and even your body stress response. So, if you are only checking one marker, fasting blood sugar, you are basically flying blind. These 6 blood tests give you a much clearer roadmap of your health. If you are one of our diabetes in the community clients, some of these tests already available at Famedix Help with Diabetes Care Center, while others may require a referral. Let's start with the most common test: fasting blood sugar. This test measures your blood sugar after you have not eaten for at least 8 hours. It is usually done first thing in the morning after an overnight fast. It tells you how well your body is controlling glucose without food coming in. If your fasting blood sugar is high, it may mean that your liver is producing too much glucose or your cells are not responding properly to insulin. Both are signs of insulin resistance. Generally, 5.6 millimoles per liter or below is considered normal. Any reading between 5.7 and 6.9 may indicate pre-diabetes, while a reading above 7 may indicate diabetes. But here is something important many people don't realize. You may have a normal fasting blood sugar and still have insulin resistance. The second test is HbA1c. This is considered the gold standard for diabetes monitoring. HbA1c shows your average blood sugar over the past 3 months. It works by measuring how much glucose is attached to your red blood cells. The more sugar in your blood, the higher your HbA1c level reading. Results are generally interpreted as below 5.7% is normal, between 5.7 and 6.4% pre-diabetes. Any reading above 6.5% and the patient will be classed as diabetic. If you already have diabetes, the goal is usually to keep your HbA1c below 7. But if you can bring it below 5.7, you dramatically reduce your risks of complications. HbA1c is not a snapshot. It shows long-term progress. So, if you improve your diet, you exercise, and use appropriate medication, this is a test that proves that your efforts are working. We have seen people reduce their HbA1c from 9% down to 6% within a few months with proper diabetes management. Next is the GFR test, which stands for glomerular filtration rate. This test tells you how well your kidneys are working. Your kidneys act like filters. They remove waste products from your blood, but high blood sugar over many years can damage those tiny filters. Once kidney damage becomes severe, it can be very difficult to reverse. That is why early detection is critical. GFR levels are generally interpreted as 90 or above, normal kidney function; 60 to 89, mild kidney damage; anything below 60 is classed as moderate to severe damage. If your GFR is dropping, it is a serious warning sign. High blood sugar, high blood pressure, and chronic inflammation can all damage the kidneys over time. But good blood sugar control can slow or even stop further damage to your kidneys. The fourth test is the lipid profile test. This test checks your cholesterol, blood fat. This is extremely important because people with diabetes have a higher risk of heart disease and stroke. The lipid profile measures four main markers: total cholesterol, LDL cholesterol, often called bad cholesterol; HDL cholesterol, the protective one called good cholesterol; and triglycerides, another form of fat in the blood. Interestingly, many of the same strategies used to reverse insulin resistance also improve cholesterol levels. These include increasing dietary fiber, reducing processed carbohydrates, maintaining a healthy weight, and building more muscle. Resistance training does help in that. Your lipid profile is very fixable, but only if you know your numbers. The fifth test is a C peptide test. This one is not commonly ordered by doctors locally, but it is extremely valuable. It tells us how much insulin your pancreas is still producing. When your body makes insulin, it releases C peptide in equal amounts. So, by measuring C peptide, we can estimate how much natural insulin your body is still making. This is important because type 2 diabetes is progressive. Over time, your pancreas becomes exhausted from producing excess insulin to overcome insulin resistance. If your C peptide level is low, it may mean your pancreas is struggling. But if you catch this early and reduce insulin resistance, you can take pressure off the pancreas and preserve insulin production. The final test is fasting insulin. Most doctors only measure blood sugar, but insulin can be elevated for many years before blood sugar rises. This is because your pancreas is working overtime, producing more and more insulin to keep your blood sugar normal. Eventually, the pancreas cannot keep up, and that is when blood sugar finally begins to rise. So, if your fasting insulin is high, it means insulin resistance is already present, even if your blood sugar looks normal. This test allows you to detect diabetes years before it actually develops. That early detection can be a game changer. Remember, blood tests are only tools. They give you information, but what truly changes your health is what you do after you get the results. Better nutrition, physical activity, stress control, and proper medical care all play an important role. If you found this video helpful, please like this video, subscribe to the channel, and share it with someone living with diabetes. And if you are in Ilorin, Kwara State, you can visit us at Famedix Healthpage Diabetes Care Center, where we help people monitor their numbers, prevent complications, and take control of their diabetes. Your health numbers matters. Know them, track them, and take action. Thank you.